Hello, I'm Linda Clarend. I lead DeNPRU Exeter. DeNPRU Exeter is a policy research unit in dementia and neurodegeneration. We're a team of researchers from 6 universities, and the unit is funded by the National Institute for Health and Care Research. Our aim at DeNPRU Exeter is to carry out policy research that helps to shape future decision-making. We work closely with the Department of Health and Social Care to provide evidence to address evolving policy needs. We involve people with lived experience and a wide range of professional stakeholders to make sure their perspectives are taken into account. In our research at DeNPRU Exeter, we're seeking to improve health and care services for people living with dementia and other neurological conditions and the families and friends who support them. Our individual projects address 3 broad themes: developing systems and services, reducing health inequalities, and improving patient and carer experience.
At DeNPRU Exeter, we drive change by championing the needs of people with neurodegenerative conditions and those that support them, using evidence to shape policy recommendations for decision makers. So far, we've helped shape national guidance, such as the Dementia 100 Toolkit. Our evidence was submitted to inform the 3 major shifts in healthcare outlined in the 10-year health plan, and our policy recommendations have been cited in key organisational documents, including Alzheimer's Society, Motor Neuron Disease Association, and Care England. As we generate new insights and recommendations, we'll make sure they reach the people who can lead and drive real change across the political landscape.
What I'm excited about is being able to collaborate with the Department of Health and Social Care and NHS colleagues to develop projects that can have a meaningful impact on the lives of those affected by neurodegenerative conditions. Being able to work alongside DeNPRU Exeter colleagues and the Friends Network to lead on a project that seeks to explore the gap between the types of support that policy and guidance says that carers should have access to and what happens in reality, because it's vital that carers receive appropriate support, and this exciting project seeks to identify what can be done to address this gap.
What I really love about working at the Policy Research Unit is the connection between research and real-world impact. So my project focuses on ethnic inequalities across the care pathway for people living with neurodegenerative conditions. And what the project highlights is the people who might fall through the cracks, which allows us to develop policies which are not only going to improve care, but also make things fair. And I really love the fact that I work in a team that is committed to evidence-based research, but more importantly, working directly with people affected by neurodegenerative conditions to improve care.
What excites me most is being able to build economic models on conditions like dementia and Parkinson's through our DeNPRU project. These models help us see the impact of interventions to reduce risk, estimate the cost involved, and the effect on people's lives and health. This evidence could then be used to support better decisions about care and services, and therefore improves people's lives.
Involvement at DeNPRU Exeter is led by the Friend Group, our Patient and Public Involvement and Engagement Group. This stands for Research Involvement Experts in Neurodegeneration, and it's the name that we chose ourselves when we started the group up. We have representation across dementia, Parkinson's disease, Huntington's disease, and motor neuron disease. The group meets regularly and gets involved in what means most to them, such as being part of a core project group, contributing to a consultation, or advising on how to share findings in an informative and accessible way. The lovely Friend Group is inclusive and diverse and provides lived experience insights to drive meaningful change for policy and practice. The group describes itself as educational, empowering, encouraging, and uplifting. And of course, everyone brings their own magic and sparkle.